When I talk to patients and ask them how they think about quality and what's important, they say, heal me, keep me safe, and be nice to me. I can't emphasize enough how excited I am that the Office of Patient Experience is now fully integrated into the Value Institute. Why is patient experience so important? It reminds me of what Maya Angelou said. Patients won't remember what you said or did, they'll remember how you made them feel. We're finding that patient experience is so critical to the overall experience in all three dimensions of quality, and they deserve the same attention and rigor around high reliability that's allowed us to produce tremendous improvements in safety, in our outcomes, and now I'm convinced we'll do it as well with patient experience.
In my role, I have the opportunity to listen to a lot of patients and families. Recently, a patient shared that as a healthcare team, we have worked to become expert clinicians to deliver the highest quality of care. And while that's great and that's what patients expect, he noted we have an opportunity to improve how we communicate with patients and families, how they experience not just the clinical care, but how much we care. Key focus for the Office of Patient Experience is communication, and you'll see that show up in a lot of different ways over the coming year and for the next few years. So this year, we're launching our Communicate to Care sessions. They're interactive, scenario-based conversations with a goal of developing and enhancing our communication skills with patients, families, and with each other. We'll be asking everyone to share their inspirational stories, and we'll be offering best practice ideas. These sessions are designed for all staff and roles. It'll be both learning and fun, and more information will be coming for leaders with details of how they can enroll people. For all of my colleagues as operational leaders, our hope is to deliver you the tools you need to do your job effectively and efficiently. I, like you, am challenged with managing multiple priorities, and we want to help simplify and focus your patient experience efforts. So less for you to do with a bigger return for our team and our patients. Beginning this month, we will be sending you an At Your Service eNewsletter with brief inspirational stories to share at huddles or staff meetings, a patient experience best practice tip, and tools and techniques that staff and volunteers can use in their efforts to improve the experience of our patients, their families, visitors, and each other. There will also be a provider-specific section that will include content that is shared by other providers. This quick read and share e-newsletter will help you keep the conversations around patient experience a top priority for our teams, and our patients will have not only the best clinical care, they will also know and experience the warmth, compassion, and caring of our hearts.
Clinical excellence is a given here at DH. I was fortunate to have best in class in the world when I had an illness myself, so I was very happy with that, and our patients know that. But they're also looking for something more than just clinical excellence. They're looking for a humanity associated with that, and that's what patient experience is all about. Whether it's the first time they catch us on the phone, the first time they step into our offices, and every time they deal with providers. We want to help those providers give the best care possible as well, and we do that by giving the providers data on what their patients think of how they're doing, coaching if they need that, and also peer support when they're particularly tough times. We need to take care of the patients, but to do that, we really need to take care of each other. And that's what really patient experience is all about.